Leading pediatric organizations are warning of a mental health crisis among teen and young children during the pandemic. The CDC says emergency visits for mental health issues increased 31% last year from ages 12 through 17. That's compared to 2019. Peyton Lance says he suffers from depression, which got worse amid the pandemic. The high school sophomore got help after telling his mom, Kimberly, about his struggles and his plans to take his own life last year. They talked with our Syracuse, New York affiliate, WTVH, at our local elementary.
Peyton came to me early in the school year and expressed that he was having difficulty, that he, in his words, wasn't doing okay.
There was like a week or two stretch where I would just sleep all day. It was just too much. Not being able to see anyone, just typing away your computer every single day like a robot.
In talking to him, we found that he was having worsening bouts of depression and anxiety for a couple years, even prior to the pandemic. But since the pandemic had started, things had gotten very dark, very bad for him. And he admitted that he did have a plan. That was very difficult to hear. It was very, very scary. As a parent, I felt like maybe I had failed in some way, that I didn't recognize something I should have. But I realized it doesn't matter what I did or didn't do before. It just mattered what I did going forward. Get him the help he needs, support him, and a lot of praying. And so that's what we did.
Dr. Ken Duckworth, Chief Medical Officer of the National Alliance on Mental Illness. He joins us right now. Good morning.
Morning, Nick.
So how has the pandemic made the mental health crisis among teens worse?
Nate, has worsened the crisis substantially. And if you think about the teen years, the young years, getting out, socialization, finding an identity, these are the core developmental tasks of these stages of life. Isolation, not being safe, feeling safe in the world, has made it all very much harder. So rates of depression, rates of anxiety, substantially higher, and suicidal thoughts. So the crisis that we had before has been accelerated by the pandemic, Nate.
Now, we were telling parents earlier in the show that we will let them know the signs they should look out for. So what are some of those signs?
Some of the signs are, so first of all, if you have a child like Peyton and he comes to you and says, here's what I'm dealing with, it will be when it's least convenient for you. You'll be working on a project. You'll be, it's the day before your tax submissions are due. Stop what you're doing, because that's an affirmation of all the love in the relationship between you and your child. When they come to you, it's a moment of tremendous vulnerability. So I'm struggling. I'm not feeling safe. That's a big moment. So take advantage of that moment if you happen to be in a situation like Peyton.
Not all kids vocalize it.
Not all kids do that, and that's why it's so impressive what Peyton was able to do. There's still a lot of shame. There's still a lot of a sense that you shouldn't have this experience. These are ordinary, common, treatable conditions, and we just have to move past this idea that people have to suffer in silence.
I was reading that one of the things that a parent should look for is losing interest in things, but in particular, losing interest in friends.
Losing interest in friends, because remember, back to the idea of development, they want to be with their friends, right? They're trying to find an identity that's separate from us, as much as we might not always love that. So loss of interest in friends, sleep changes, changes in grades, irritability and anger can be a sign of depression. It's not always sadness and withdrawal. Isolation is a concern, and I feel like there's a constellation of things that are fairly non-specific. But when you start to add them up, an evaluation might be a good idea.
I thought it was interesting that the mother said, which is what most parents would say, what did I do, what did I not do? So what should we do and what should we not do?
Well, first of all, it's not your fault. And I think it's
hard
really,
not to feel it's your fault,
hard
though,
not to
honestly.
feel it, isn't it?
Yes.
Because we're so invested in doing the right thing for our kids, and we take credit for their success. Wait a minute. But the truth is, 1 in 4, 1 in 5, and in the pandemic, even higher numbers of teenagers are experiencing depression, anxiety, and suicidal thoughts.
So what are we supposed to do, Ken?
What are we supposed to do? Right? So first of all,
the good and the bad, keep
the conversation going. It's okay to have this. It's okay to be talking about this experience. That's important to keep the conversation going.
And what if they say, I don't want to talk about it, everything's fine? And
I
you
don't
can tell
want to
some-
talk
yeah.
about it, everything's fine. So, you know, this is my experience, pressing straight on it, you know, you look depressed, you need help, may not be your best strategy. Because the person could say, oh, actually, that's not really where I want to. So find something that they see that you also see. I can't sleep. None of my friends want to talk to me. Focus on that. In the Venn diagram of what you see, which is I'm worried you might be depressed, and the Venn diagram of what they can see, I'm not sleeping and my friends don't want to talk to me, focus on the purple, right in the middle. And say, well, let's talk about the sleep, or let's talk about the friends, and let's work off of that, because that matters to you. Another strategy is to get a pediatrician involved. Most people love their pediatricians, right? Pediatricians are basically wonderful human beings. And they're the unappreciated heroes of the American mental health system. They're one of the backbones of the American mental health system. And so say, you know, because you're having trouble sleeping, do you mind if we call Dr. Smith? Like, well, I like Dr. Smith. Well, this is part of pediatricians. No,
for sure.
Mental health is a big part of pediatric work. So if they won't talk to you, see if you can get another person to engage in the conversation. And if you get a call from a friend who's worried about your child, that's an urgent situation.
Take it serious.
Take it seriously.
No doubt. Now, I hear you, and what I'm hearing as a parent is we need to be hyper aware of what was going on in the home.
But also, it's not our fault.
It's not our fault, but we should be hyper aware.
You know, it's complicated, isn't it? Because you have to be fully engaged.
No doubt.
It's not your fault.
We have to go. Dr. Kenworth, thank you. Dr. Duckworth, I appreciate you so much. If you or someone is seeking mental health resources, you can call the National Alliance on Mental Illness Helpline. That's 1-800-950-6264. Or in a crisis, text NAMI to 741-741. We'll be right back.